I have a question regarding my husband. He has a thyroid, and that was like 45 years back when he was being diagnosed, and that was followed by Graves' disease. So my question is there any thing which we can do about the Graves' disease? Is there, because his eyes are really kind of big, and if yes, any treatment can be done, is it safe?
That's a good question. And Graves' disease is a multifactorial type of disease. It affects multiple parts of the body, basically, and eyes is one of them. They can cause the eyes to protrude out a little bit, causing dry eyes, something that we've been talking about. It can make it very uncomfortable, and also it can affect the muscles of the eyes, causing double vision. If those are concerns for you, it definitely requires a medical exam with an ophthalmologist, and that's something that really is required for somebody with Graves' disease at least once a year.
As Dr. Wang was saying, thyroid disease can affect the eyes in multiple ways: dryness, your muscles, and it can affect the nerve as well. When you get a buildup of basically fat and tissue behind the eye, it causes the eye to come further forward. There are surgeries called decompression surgeries that can relieve this. There are eyelid surgeries as well that can be done to get the eyelid to cover the eye more. So the first step would be getting an evaluation to see if the eye protrusion is enough to warrant a surgical intervention.
Thank you, doctors. Let's take another call. Hi, welcome to Doc Talk. What's your question?
Hi, Dr. Thanks for picking up my call. I just have a question about I was recently told by my internal medicine doctor that I have a STEMI in my right eye. Is that infectious, harmful, or? And then my second question is how difficult it is to just get it removed.
Great question.
All right, so you're asking about a sty on the eyelid. So sties are basically blocked up pores along the eyelashes, and we start with medical treatment like warm compresses or eyelid scrubs and some topical medication. But if that doesn't do the trick, we oftentimes will need to do surgery. It's best to be evaluated just to see what stage you are at right now.
Let's take another call. Hi, welcome to Doc Talk. What's your question?
Excuse me, I've had an eye inflammation before, and I want to know what causes it.
The question was about an eye infection? Or let's talk about risk factors and how we can get eye infections or inflammation.
I think the caller was asking about inflammation. There are many different parts of the eye where you can get inflammation. The most common part is in the center of the eye. You certainly can get inflammation of the retina as well. A lot of underlying systemic conditions, autoimmune diseases, lupus, can cause inflammation in the eye. Usually when we have someone who has persistent inflammation in the eye, we'll run blood tests and lab work to see what is the underlying cause. If you have a condition that you know is related, the most important thing is getting that condition well controlled, working with your rheumatologist or your other doctors to get that under control.
Thank you, Dr. Agrawal. Let's take another live caller. Hi, welcome to Doc Talk. What's your question?
Yeah, hi. After the cataract operations, should somebody use any kind of eye drops or so?
So after cataract operations or eye drops?
Okay, yeah, so after cataract surgery, after cataract surgery, right afterwards, you are on some post-operative drops, and that's something that's managed by your surgeon. But you're probably asking for, what are some maintenance treatments, or what are things to be concerned about after cataract surgery? Just like we've been mentioning, dry eye can be one. Sometimes you can get some inflammation that we need to take a look at, which comes in the form of achy eyes or light sensitivity. But in general, with cataract surgery, there's nothing that's required after your normal post-operative phase.
Dry eyes cataract surgery does predispose you to more dryness of the eyes afterwards, so artificial tears that are over the counter are a great place to start.
Thank you, guys. So over the break, Anjana called asking a question I'm sure many of us want to know, and I was told as a child myself, is this a myth or not? But watching TV as a young child, will that affect their vision? Or basically my mom said I will go blind.
Recent studies have suggested that when we do more close-up work, reading, looking at our phone, that actually the population is becoming more nearsighted. Now, television usually is a little bit farther away. If you're sitting right up close to the television, that may affect it, but besides causing dryness, there's otherwise nothing really that watching TV will do to affect your vision.
Thank you. Let's take another live caller. Hi, welcome to Doc Talk. What's your question?
Hi, my question is for my daughter who's around 7. So whenever she sleeps, her eyes are never closed properly, fully. And every day when she wakes up, she's like, I cannot see, and she needs her glasses. So is that a problem, or, what could be my solution?
So sometimes you need your glasses. Most of the time, you need your glasses in order to see clearly. So that's normal to use glasses to see clearly. Now, the fact that she sleeps and her eyes are partially open, that's difficult to tell over the radio waves. It might be that the eyes are a little bit more built forward. It could be that the eyelids just aren't completely closing because there's some tension. That's definitely something that you should have an ophthalmologist take a look at, because long run that will dry out your eyes.
As Dr. Wang was saying, that certainly there can be other causes of it. It is something that can be common. A lot of people, when we're dreaming, our eyes will open at night, especially if you have the fan or air conditioning on. That will then dry out your eyes. You can wake up with crusting and mucus around the eyes. One thing you can do, put artificial tears in at night before you go to sleep. When you wake up, lubricating eye ointment is a good option too. You can even do a sleep mask or turn down the fan or the air conditioning to help with that.
Great points. Let's take another live caller. Hi, welcome to Doc Talk. What's your question?
I have a question in regards to my 4-year-old. His vision was just checked, and one of his eye has a different power. It's 20/50 versus the other is 20/30. The doctor told us that it might be a year before we can get it checked, but in the meantime you could do some exercises by closing one eye using an eye patch. How much effective that process is, and will his both the eyes be same by the time he's 5?
That is a great and very important question. Typically, a child's brain has until around age 12 to 17 to develop properly for vision. If there's a difference in the vision between the two eyes, it is very important to try to get that to be equal and as good as possible. If one eye is weak, that child will try not to use the eye and their brain will not develop properly for it. So patching therapy is an important component of getting that eye to be stronger. Definitely, your child needs to see a pediatric ophthalmologist to figure out the best treatment for that as soon as possible.
Thank you, Dr. Agrawal and Dr. Wang. So just to everybody, this is Doc Talk Live. We're discussing the eye. Please continue to call the studio with your questions, 972-235-5555. Let's take a caller. Hi, welcome to Doc Talk. What's your question?
Hi, this is Kuldeep. This is regarding my son, who is around 10 years old. And he has glasses. He uses number around 2.75, another one on 3. He has pollen allergy also. So my question is that for kids with allergies, and they have a lot of itchy eyes, especially in this season, even with the medication and all that, how does that impact the vision? Does constant allergy every year on year impact the vision?
Yeah, no, that's a good question. As far as the glasses goes, it seems like a pretty normal prescription. As far as your allergies, very common, even in young kids. And it sounds like he's being properly medicated with the anti-allergy drops and medications. How it affects the vision is variable. It depends on how much tearing and how much of the surface of the eye is being affected. Oftentimes, if it is very watery or if it's patchy, then it can cause some temporary blurriness.
Thank you, Dr. Wayne. Let's take another live caller. What's your question?
My question is in regards to my eye condition. I feel like whenever I get exposed to sunlight, I tend to sneeze, and the bright light actually tends to make me sneeze. So I just wanted to make sure if anything is related into eye and any eye disorders that I have to look forward to.
Dr. Agrawal?
That is a very interesting question that we do get sometimes. Actually, there's a reflex in some people where they look at the light and it causes them to sneeze. It is nothing dangerous, as far as I know, not related to any particular condition. It just happens to be that you have that reflex.
Excellent. Let's take a live caller. Hi, welcome to Doc Talk. What's your question?
Hi, I had a question. So basically, I've had a lot of insecurities about my eyes because they're so small, and so I was wondering, like, what do you recommend?
That's a good question. I also feel your pain there. But you know, having small, what we call palpebral fissures, or the space between the eyelids, isn't necessarily affecting your eyes or your vision. It depends if there's something going on with the eye itself. Sometimes, you know, it can be poorly developed, causing them to be smaller, but as long as your vision is doing all right, having particularly smaller eyes isn't necessarily bad for your eyes, or your vision.
Let's take a live caller. Hi, welcome to Doc Talk. What's your question?
If the doctor can answer if there has been any cure found for eye floaters, because I have quite a few of them, and I was told that there is no cure for them. So has there been any treatments for that recently?
Sure, treatments for eye floaters.
Yeah, there's treatments. So the treatments are more based off a case-by-case basis, but to talk about them, there's either surgery where we take away the floaters in the back of the eyes. The floaters are generated by the vitreous, which is the jelly in the back of the eyes, and at this point, you know, you can remove it with surgery. There's a laser that can be done. But typically, we don't recommend that unless it's really bothering you. Usually, I give it about 50% or more of the day.
Okay, let's take another live caller. Hi, welcome to Doc Talk. What's your question?
Is Phoenicia Richardson Theatre offering buy one get one free on all Monday to Thursday?
That I am not sure about, but right now we're on Doc Talk Live. Let's take another live caller. Hi, welcome to Doc Talk. What's your question?
Hi, I have a prescription glass, minus 1.75. It's a new one, so what's happening, like, when I see the nearest things, like when I'm reading a book or seeing the computer, with the glasses, it's difficult for me to do it. When I remove the glasses, I can get it clearly. But for long distance, if I wear the glass, it's good. So it was not there before with my previous prescription glasses. So is it a problem with the prescription glass, or should I check with the doctor again?
It's always a good idea to check with your doctor again, but as we get older, especially around 40 years old, we start to develop difficulty seeing up close. You may see better up close without your glasses because you're naturally nearsighted with that prescription. When you're putting the glasses on, it is helping you see distance, but you're having difficulty now seeing up close just because our eye muscles get weaker with time for near vision.
As we're coming to an end of our show, I know a previous caller asked about the movies, if they buy one, get one free. So please call it in like 10 minutes and we'll have an answer for you. Again, thank you all for listening to Doc Talk Live. We've been doing this for the last 4 years and we continue to love your support and your questions. If we didn't answer your question today, please go to our website and then our wonderful guests here will get back to you. Also, they can quickly tell you where you can find them. So why don't you tell us?
Where you can find us easily on our website, www.northdallasi.com. You can also find us on Facebook, www.facebook.com/North Dallas Eye Associates. You can also find us on the Doc Talk Live website.
Well, I hope you guys enjoyed the show today. We had lots of wonderful questions. Again, thank you for listening, and always stay healthy, Dallas.